Did you know that high cholesterol can affect anyone at any age, and most people don't even know they have it? Today, we're focusing on high cholesterol, a condition that often goes unnoticed until it's too late. Cholesterol is a fatty substance that's vital for the normal functioning of the body. However, when levels in the blood get too high, it can lead to serious health problems like heart disease and stroke. The tricky part? High cholesterol doesn't usually cause any symptoms until these complications arise. That's why it's often called a silent killer. Before we dive into the signs, let's quickly understand that not all cholesterol is bad. There's HDL, the good cholesterol, and LDL, the bad cholesterol. It's the imbalance of these that can lead to health issues. And to understand the early signs of high cholesterol, it's crucial to know what cholesterol levels are considered normal. Cholesterol is measured in milligrams per deciliter, abbreviated as mgdl. Let's break down the numbers. For total cholesterol, a normal level for adults is less than 200 mgdl. Levels between 200 and 239 mgdl are considered borderline high, and levels at 240 mgdl or above are high. Moving on to LDL or bad cholesterol, the optimal level for adults is below 100 mgdl. If you have a history of heart disease or other risk factors, your doctor may recommend an even lower level, below 70 mgdl. Levels between 130 and 159 mgdl are borderline high, while levels at 160 mgdl or above are high, with 190 mgdl being considered very high. As for HDL or good cholesterol, higher levels are actually better. An ideal level for adults is 60 mg/dl or higher. However, for men, an acceptable level is 40 mg/dl or more, and for women, it's 50 mg/dl or more. Low HDL cholesterol levels are less than 40 mg/dl for men and less than 50 mg/dl for women. Triglycerides are another type of fat in your blood that can increase your risk of heart disease when levels are high. A normal triglyceride level is less than 150 mg/dl. Levels between 150 and 199 mg/dl are borderline high, 200 to 499 mg/dl are high, and 500 mg/dl or above are very high. As mentioned earlier, high cholesterol is often called a silent killer. But there are signs to watch out for. Sign 1: Xanthelasma Palpebrarum. These are distinctive, soft, yellowish plaques that typically appear on or around the eyelids, particularly near the inner canthus, the corner where the eyelids meet. These plaques are deposits of cholesterol and lipids under the skin's surface and are more common in individuals with high levels of low-density lipoprotein, LDL, or bad cholesterol. They can also be associated with other conditions that cause high cholesterol, such as liver disease and diabetes. While Xanthelasma palpebrarum themselves are harmless and don't cause pain or vision problems, their presence is often a cosmetic concern for patients. More importantly, they serve as a visual indicator of potential hypercholesterolemia, which warrants further investigation and possibly lifestyle changes or medical intervention to manage cholesterol levels. Sign 2: Arcus Senilis. Arcus Senilis, also known as corneal arcus, is a gray or white arc or ring that appears around the periphery of the cornea. It's caused by lipid deposits in the cornea and can be a sign of dyslipidemia, including high cholesterol and triglyceride levels. While it's true that Arcus Senilis is more commonly seen in older adults and can be a normal part of aging, its presence in younger individuals is more concerning and may suggest an underlying lipid metabolism disorder. In younger people, especially those under the age of 40, Arcus Senilis could be an indication of familial hypercholesterolemia or other types of genetic dyslipidemias. It's important for individuals with this sign to get a full lipid profile test done to assess their cardiovascular risk and to determine if they need to take steps to lower their cholesterol levels. Sign 3: Xanthomas. These are cholesterol deposits that can manifest as flat or slightly raised yellowish areas on the skin. They often appear on the elbows, joints, tendons, knees, hands, and feet. These lesions occur when there is an excess of lipids in the bloodstream, which causes the cholesterol to deposit in the skin tissues. Xanthomas can vary in size, and while they are not painful, they can be a sign of underlying lipid disorders, including high cholesterol levels. They may also indicate an increased risk for cardiovascular disease, especially if they are widespread or develop rapidly. Xanthomas are a physical manifestation of high cholesterol and can sometimes be tender or itchy. Sign 4: Tendon Xanthomas. Tendon xanthomas are similar to xanthomas but are specifically located within the tendons. These nodules or lumps are made up of cholesterol and can be felt as firm, painless bumps along the tendons, most commonly found in the Achilles tendon and the extensor tendons of the hands. Their presence is a strong indicator of familial hypercholesterolemia, a genetic condition characterized by very high LDL cholesterol levels. Tendon Xanthomas are particularly concerning because they suggest long-standing elevated cholesterol levels, which may have already contributed to the development of atherosclerotic plaques in the arteries. Sign 5. Chest pain or angina. Chest pain or angina is a symptom that can occur when there is not enough oxygen-rich blood reaching the heart muscle. This condition is often a result of atherosclerosis, where the arteries become narrowed and hardened due to a buildup of cholesterol and other substances. The pain is typically described as a pressure, heaviness, tightness, or squeezing sensation in the chest and may be accompanied by shortness of breath, fatigue, and nausea. Angina is a warning sign that you may be at risk for a heart attack or stroke and requires immediate medical attention. It's a clear indication that high cholesterol may be affecting your cardiovascular health and that lifestyle changes or medication may be necessary to manage the risk. Sign 6. Fatty deposits around the body. These deposits, known as xanthomas, can appear as bumps or lumps under the skin, particularly around the eyes, elbows, knees, and tendons. These deposits can vary in size and may be tender to the touch. They are a physical sign of high cholesterol levels and can sometimes be seen in individuals with familial hypercholesterolemia or other conditions that cause high levels of lipids in the blood. Xanthomas are not harmful in themselves, but indicate that cholesterol management is needed to prevent more serious health issues. While these signs can be indicators of high cholesterol, the most reliable way to know your cholesterol levels is through a blood test. It's a simple check that can be done at your doctor's office, and it's an essential part of maintaining your health. If you have any of these signs or if you have a family history of high cholesterol, it's especially important to get tested. Managing high cholesterol often involves lifestyle changes such as diet and exercise, and sometimes medication. By keeping your cholesterol levels in check, you can significantly reduce your risk of heart disease and stroke. Thank you for tuning in. Remember, knowledge is the first step to a healthier life. If you have concerns about your cholesterol, don't hesitate to reach out to a healthcare professional. Stay informed, stay healthy, and see you in the next video.